Penn RN Research News.
We studied 67 neonatal intensive care units throughout the country, and in them we studied 11,000 infants that they cared for that were born in those hospitals in the years 2008 and 2009. And one thing to note about these very low birth weight infants is that they are typically hospitalized for their first 2 months of life. So they are in the hospital a very long time, dependent on nurses, and often with intravenous catheters to help sustain their life. We studied very low birth weight infants, which means that they weigh less than 3 pounds, 4 ounces, which is less than half the weight of a typical newborn. An average newborn grows to be 40 weeks, and then they're born. But very low birth weight infants could be born as much as 16 weeks early. So you can imagine that they're not fully grown, they're not fully developed. The types of infections that commonly occur in these infants, and in our study, 14% of infants had an infection they acquired in the hospital, is a bacterial infection in the blood, a staphylococcus infection, which is also called a staph infection, that they get from having an intravenous catheter. Because the babies are so premature, they need the catheter to get fluid, to get nutrition, to get medication, and so having the catheter helps them to sustain life, and yet they're very vulnerable to infection, and the nurse is the one who maintains the cleanliness of the catheter. Well, there's 3 reasons that these babies are highly susceptible. One is that their immune system is not fully developed, so they simply are defenseless. Another is that they have the catheters to be sustaining life. And the third is that their skin is just so much thinner. It's nearly transparent, and so that means that it is more penetrable. Overall, there should be 1 nurse for every 2 infants, but for very complex infants, highly vulnerable infants, there should be more than 1 nurse per infant. And what we found was that instead, in general, 1 nurse is caring for about 2.5 infants. So if you could imagine that for a group of 10 infants, we found there were only 4 nurses, but there should be 5. So that is a 25% increase would be needed to meet these guidelines that have been developed by national medical and nursing specialty groups. Well, hospitals face tremendous financial pressures. Those are only increasing. They operate in competitive markets, and nurses are the largest group of providers, of employees in a hospital. And so a hospital might cut nursing, minimize nursing in an attempt to reduce expenses, not realizing that they're not providing enough nurses to meet patient needs, to meet national guidelines. Well, a magnet hospital is a hospital that's been accredited by a national organization for meeting standards of nursing excellence in innovation and in practice. And so there are few hospitals that meet this very high standard, but in them you can know that you're getting exemplary nursing care. In our research, we find that very low birth weight babies, these tiny premature babies, when they're born in magnet hospitals, they do better. there's less chance that they'll die, less chance they'll develop an infection, and less chance that they will develop a severe brain hemorrhage. So clearly, the better place for these premature infants to be born would be in a hospital accredited for nursing excellence.